Hi, today I'm going to talk about how to treat a fever. Like I said in my last video, fever is above 100 degrees Fahrenheit or 38 degrees centigrade, and between 100 to 104 degrees Fahrenheit it is usually protective or beneficial to the body. Now, before I go into the subject of treating a fever, a few words of caution. One is that anytime the child or adult looks unwell while having a fever or no fever, they should be taken for medical attention immediately. Second is that if the child is very young, especially if they are less than 3 months of age, or they have been out of the NICU, that is they are premature and had several complications, or if they are children born with some problems with the respiratory, kidney, liver, brain, or genetic problems, or if they have immune deficiencies, or they are on medications like steroids which reduces their immunity, they are also highly vulnerable people and they should be given medical attention immediately. And the third thing is that children less than 5 years of age, especially if they are less than 3, they are slightly prone for having a seizure during a fever. Not all of them, but some of them. So in case they happen to have a seizure, I would suggest that you make them safe and do all the appropriate things that you have been asked to do when they have a seizure, while at the same time trying to reduce their body temperature. So those are the words of caution. Now coming back to the topic of treating the fever. So many people would rightfully ask that if the fever is beneficial to the body, especially between 100 to 104 degrees Fahrenheit, should we be treating it at all? I would agree with that, and if the child or adult, whoever is febrile, is comfortable and not bothered by the fever, then there is no need to give any medication. If your child does not belong to any of the high risk categories I mentioned before, then you can manage the fever at home for 24 to 48 hours before seeking medical attention. Anyway, the principles of treating a fever is to cool the body down. It can be done with medicines and non-medical ways. So we'll focus on the non-medical ways. First thing is to get rid of the layers of clothing. Just before the fever starts, many of the children shiver and they feel very cold. That is when the parents put many layers of clothing or blankets to make them feel comfortable. So just when the shivering stops, then you check the body temperature and you would find that the body has become very hot, and that is when you have to remove the layers of clothing. That itself will help the body to cool down. So if that is helpful, you can keep checking the temperature, and if it is cooling down, then that's good. If that is not helped, then you can switch on the fan or the AC. That will also help to cool the body down. Then the next step is to do tepid sponging. Now tepid means temperature which is just at the body temperature or slightly higher. Not the febrile child, but our own normal body temperature. How do we check for that? The easiest way is to dip our elbow, tip of the elbow in the bowl of water, and if that is comfortable, then that is the correct temperature. This is especially useful if we are living in cold climates or in winter when the tap water is very cold. So we can adjust the temperature of the water and do the tepid sponging. The traditional way of teaching is to dip a towel in the bowl of water, wring out the excess water, and then to apply the slightly wet towel on the forehead, face, neck, armpits, front of the body, back of the body, groin, the legs, etc. This is the traditional way, while at the same time checking to see how the body's temperature is going down or not. If the body temperature is going down, it won't go down to completely to normal, but will be close to 100. Then you can stop the tepid sponging, keep monitoring the temperature, and restart again when the temperature goes up. The other way I have found very useful in my practice is that I dip my hand in water or wet my hand and with a little bit of water I smear the whole body, the face, etc., the neck, back, armpits, etc., especially if the children are like 1 year old or 2 year old. It's very easy to do it this way. This way we also have a good idea what the temperature of the water is like. Another point to note is that when we start the tepid sponging, the person will be really surprised, because the body temperature of their body temperature is at variance to the tepid water. So for the first 5 to 10 seconds they'll feel very uncomfortable. So we should be prepared for that, and then confidently continue with it, and that will help us to do a proper tepid sponging. Thank you.